Hello, I'm Dr. Daniel Carter. Today, I want to talk about something I see every single day in my practice, something that honestly keeps me up at night. If you, or someone you care about, frequently wake up with a dry mouth, that awful cotton mouth feeling like you've been chewing on dry cotton all night, listen closely. What I'm about to share could genuinely change your life. That symptom so many dismiss as just a normal part of getting older is actually one of the most serious warning signals your body can send. No, it's not normal, and it's definitely not harmless. I've seen far too many older adults ignore this sign, and the consequences have been devastating. Behind that dryness hides a real danger, a direct link to serious conditions like aspiration pneumonia and systemic infections that can put your entire health at risk. But here's the good news. Understanding the danger is the first step to shutting it down. Stay with me, because I'm not only going to explain why this is a silent emergency, I'm also going to give you a clear, practical action plan you can start using today. My goal isn't to scare you, it's to wake you up. The silent hero in your mouth. Why saliva is more valuable than gold. Before we dive into the dangers, we need to talk about the forgotten star of this story, your saliva. We tend to think of it as just water. Big mistake. Saliva is one of the most complex and valuable fluids in your body. Think of it not as plain water, but as your own personal 24/7 security and maintenance team. First, saliva is your mouth's immune guardian. It's loaded with compounds that fight bacteria, viruses, and fungi. Every time you swallow, you send a powerful wave that flushes millions of harmful germs down to your stomach acid, where they're destroyed. Without enough saliva, those microbes don't go anywhere. They stay, multiply, and throw a very dangerous party in your mouth, turning it into a perfect breeding ground for infection. Second, saliva is your first-stage food digester. It contains enzymes like amylase that start breaking down your food from the very first bite. Without it, digestion gets off to a rough start, and nutrient absorption, which becomes so important as we age, takes a serious hit. And here's the critical part. Saliva is the master lubricant. It lets you speak clearly, chew without pain, and, most importantly, swallow safely. Try swallowing right now. Feel how saliva helps everything glide down smoothly. Now imagine trying to swallow a piece of bread or meat with a completely dry mouth. It's like trying to push a boat across the desert. The food doesn't form that compact, slippery ball we call a bolus. It sticks, it falls apart, and that's where the road to disaster begins. On top of everything, saliva is a natural healer. It constantly bathes your teeth with calcium and phosphate, repairing tiny acid attacks throughout the day and helping heal small wounds in your mouth. A dry mouth is a mouth that can't repair itself. The medical term for this is xerostomia, and it's not just a feeling. It's the real, measurable loss of this guardian, digester, and lubricant. When this protector disappears, especially at night, your mouth is left defenseless, turning from a balanced environment into a biological war zone. That pasty, sticky mouth you wake up with is the siren telling you your defenses have fallen. Ignoring it is like disabling the smoke alarm in your house because the noise bothers you. Unmasking the culprits. The real causes of waking up with a dry mouth. So who's sabotaging this vital saliva production? It's rarely just one villain. It's usually a perfect storm of factors. Let's identify the main suspects. Pay attention, because you're likely to recognize yourself in at least one. Because number one, your bathroom cabinet, your medications. This is by far the number one culprit in older adults. Over 500 commonly prescribed medications list dry mouth as a side effect, and the problem multiplies because many people take not one, but 5, 10, or more pills daily. It's an additive effect. We're talking blood pressure meds, antihistamines for allergies, antidepressants, muscle relaxants, Parkinson's medications. The list goes on. These drugs are often necessary, but they frequently interfere with the nerve signals that tell your salivary glands to produce. They block that communication, and the saliva factories simply slow way down. Cause number 2, the nighttime thief, mouth breathing. While you sleep, you should be breathing through your nose, which is designed to warm and humidify the air. But if you're breathing through your mouth, whether from nasal congestion, a deviated septum, or something more serious like sleep apnea, you're asking for trouble. Picture this. For 8 hours straight, dry air flows constantly over the moist surfaces of your mouth. It's like leaving wet laundry out in a windy day. By morning, it's stiff and bone dry. The little saliva you do produce evaporates instantly, creating paradise for the worst bacteria. Cause number 3, diseases that shout through your mouth. Sometimes dry mouth isn't a side effect. It's the main red flag of a condition that needs urgent attention. Classic example, diabetes. Poorly controlled blood sugar affects the whole body, including the salivary glands. Plus, high glucose in the saliva itself becomes food for bacteria. Double damage. Then there's Sjogren's syndrome, an autoimmune disease where the body mistakenly attacks moisture-producing glands like the salivary and tear glands. It's more common in women over 40 and often goes undiagnosed for years. Other conditions, Parkinson's, rheumatoid arthritis, or nerve damage in the head or neck, can also dry the mouth. Cause number 4, daily habits that cost you dearly. Finally, our everyday choices. Chronic dehydration is a silent epidemic in older adults. As we age, our thirst signal becomes less reliable. You can be dehydrated and not even feel it. If there's no water in the system, the body won't waste it on saliva. And of course, the major villains, tobacco and alcohol. Smoking dries the mouth and damages salivary glands. Alcohol is a diuretic that dehydrates you further. Coffee, tea, and colas add to the problem. As you can see, these causes often overlap. An older adult on multiple medications with diabetes, mouth breathing, and not drinking enough water has the perfect recipe for oral disaster. And that disaster, as we'll see next, can have truly life-threatening consequences. The chain of dangers. How dry mouth threatens your life. This is where we get serious. Here's how that seemingly minor symptom connects to life-threatening risks. Danger. Number 1. Aspiration pneumonia, the silent killer. This is the most acute and frightening risk. Aspiration pneumonia is a lung infection that happens when food, liquids, or saliva go down the wrong pipe and end up in the lungs. Dry mouth is a major risk factor for this to occur. Without enough saliva, food doesn't lubricate properly. Chewing creates dry, loose particles. When you try to swallow, control over those particles is much weaker, and a dry mouth is already loaded with dangerous bacteria. A tiny germ-laden food particle slips into the lungs, violent infection, pneumonia. In a younger person, a strong cough reflex might clear it, but in an older adult, with weaker cough muscles and a less robust immune system, that particle stays, and the infection spreads. I've seen patients in the ICU fighting for every breath because of aspiration pneumonia that began months earlier, with nothing more than complaints of a dry mouth. Danger. Number 2. Rampant infection, from cavities to sepsis. A mouth without saliva is a feast for cavity-causing bacteria, and not the usual kind. In older adults, we often see root caries, a far more aggressive type that attacks exposed tooth roots once gums recede. Without saliva, destruction happens lightning fast, but it doesn't stop there. Those bacteria inflame the gums, gingivitis, then destroy the bones supporting the teeth, periodontitis, the number 1 cause of tooth loss in adults. And listen closely. Bleeding gums are an open door to the bloodstream. Bacteria like Porphyromonas gingivalis can travel throughout the body, and research has linked them to higher risks of heart disease, stroke, and even Alzheimer's. In the worst cases, a severe dental infection can trigger sepsis, a deadly full-body chain reaction. It can all start with a dry mouth. Danger. 3. Malnutrition and social isolation. This one is more subtle. When your mouth is dry, eating hurts. Chewing becomes torture. As a result, people stop eating nutritious foods that require chewing. Meats, fruits, vegetables, and switch to purees or soft, often processed foods. That's a fast track to malnutrition, which leads to muscle weakness, higher fall risk, a weakened immune system, and a vicious cycle of decline. And don't forget the human toll. Chronic bad breath embarrasses. Difficulty speaking frustrates. Out of shame, many people withdraw, skipping family meals, losing social connections. It's a kind of living death that steals joy from the golden years. Dry mouth is the first domino. But now that you understand the danger, it's time to act. The rescue plan. My personal protocol to revive your mouth. Enough bad news? Let's talk solutions. I'm giving you my own step-by-step protocol. It's not complicated, but it requires consistency. Follow these steps, and I promise you'll notice a difference. Step 1. Hydration is queen. Your new best friend is a water bottle. The golden rule isn't chugging large amounts, it's small, frequent sips all day long. Set a reminder every 30-45 minutes if needed. Never wait to feel thirsty. Keep a glass by your bedside. Treat hydration like your most important medicine, because right now, it is. Step 2. Impeccable hygiene protocol. When your mouth is dry, good hygiene isn't enough. It has to be flawless to control the bacteria your saliva no longer handles. Brush at least twice a day with a soft bristle toothbrush and fluoride toothpaste. Don't scrub. Gently massage teeth and gums. Clean your tongue daily with a tongue scraper to remove odor-causing bacteria. Floss every day, no exceptions, especially before bed. My homemade rinse. Forget alcohol-based commercial mouthwashes that dry you out more. Mix 1-2 teaspoons of salt in a glass of warm water. Swish for 30-60 seconds after brushing. It soothes inflammation and cuts bacteria. Step 3. Stimulate your own saliva factories. You can trick your glands into working harder. Chew sugar-free gum or suck on sugar-free candies containing xylitol. Xylitol starves harmful bacteria, they can't digest it, while stimulating saliva and fighting cavities at the same time. Eat firm, fibrous foods, apple slices, celery, carrots, to naturally stimulate flow. Step 4. Create a nighttime oasis. The night is your mouth's most vulnerable time. The best investment you can make is a cool mist humidifier. Run it in your bedroom every night. It keeps the air moist and dramatically reduces morning dryness. The difference when you wake up is noticeable. Step 5. Massage your salivary glands. Yes, you can manually stimulate them. The largest ones, parotid glands, are in your cheeks, right in front of your ears. Using your index and middle fingers, massage that area with gentle circular motions for about a minute. Do this a couple of times a day. Step 6. Audit your diet and habits. Be a detective with what you consume. Cut back on coffee, tea, sodas, and especially alcohol. Avoid very salty or spicy foods. If you smoke, understand that it's one of the worst things you can do to your oral health. Let this be your final wake-up call to get help and quit. Step 7. The visit you can't postpone. This is the most important step. My protocol helps, but it doesn't replace professional care. If dryness continues after a couple of weeks of these steps, it's a clear signal you need expert help. This isn't optional, it's essential. And that brings us to the final, most critical action. Don't ignore this signal one more day. Pick up your phone right now and schedule an appointment with your dentist. When you're there, say these exact words. I wake up with a dry mouth and I'm worried about the risks. Be your own advocate, then make a full list of every medication and supplement you take. Bring it to your primary doctor and ask directly, could this combination be causing my dry mouth? Are there alternatives? Waking up with a dry mouth is not a life sentence, it's a warning, and a warning only helps if you act on it. Today, I've given you the knowledge and the plan to fight back. Your whole body health begins in your mouth. Protect your saliva like the treasure it is. If this video opened your eyes, share it. Send it to a parent, grandparent, or friend. One simple share could dramatically improve someone's quality of life. Subscribe for more clear, straightforward health advice. A healthy mouth is the first step toward a long, vibrant life.